So happy to have you here. Today we again have our special guest, Mandy Kanzler, because this is the second in our series of optimizing your practice. And today's topic is, I think, a topic that pertains to every single medical practice, not just ophthalmology, but any practice. I think kind of more so in ophthalmology because we do so much testing and because we're processing a lot more patients than, say, a GP might see or a surgeon. So I'm glad you joined us. Mandy's going to give you some good tips, and we're going to talk about why it's important to streamline your flow. And there's some very important reasons. And a lot of it has to do with patient satisfaction. We all have had doctors that we go to who make us wait a long time. And I know every one of us has. So something that we also feel personally. So I'm going to go ahead and turn it over to Mandy. Mandy, welcome.
Thank you for the introduction, and for all of you for being here today and taking time out of your busy day. We are going to be talking about streamlining patient flow and what does that look like and what we do in our practice every day. Optimizing patient flow really allows patients to move smoothly and efficiently through our practice. So you may be asking, what does streamlining look like? From arrival to the checkout, having minimal delays, and being able to use our resources, maximize the utilization of our resources. Having a smooth flow doesn't happen by accident or even luck. It happens because we're intentional in assessing what our needs are, as well as putting solutions in place. There are many elements that contribute to optimize patient flow, and which we're going to jump into and talk about today. So why is it so crucial in ophthalmology to have efficient patient flow? Well, when patients receive timely care, they tend to be happier. They're focused on the nature and the information of the visit at hand instead of focusing on the emotion of feeling frustrated due to waiting. Think about when you've been unhappy at a time with an experience that you've been somewhere. It's easy to be distracted from every little thing that's frustrating, either our wait time or the interaction from a rude encounter with someone, instead of really focusing on what are we there for and what do we need out of our time there. So it's really important to have a smooth flow for patient satisfaction. We also want to utilize and engage our people well. Without being intentional in utilizing our team to their fullest potential, we're leaving opportunity off the table for growth for people on our team. So you may want to ask yourself, throughout this presentation, what are the resources that I currently have right now on my team, and how am I utilizing them? Maybe you're listening to this with a group of leaders. How are each of you engaging and utilizing the resources that you have? Efficient appointment scheduling begins with a lot of different pieces, actually. Smart scheduling techniques, maybe staggering appointment times, prioritizing based on what the patient needs are to prevent overcrowding in the schedules and to reduce patient wait time. Maybe it's using search ahead or the look ahead feature to have templates that are in place to allow your team to automatically look instead of having to manually hunt and search. Maybe it's creating linked appointments so that you're able to utilize that schedule to the best capacity instead of hunting between different, pieces of equipment or rooms or physicians, however your templates are built to align those schedules for an appointment. Streamlining registration and check-in processes for front office are hugely important as well. So there's many pieces to being efficient outside of just the clinic. Oftentimes we think about, was the clinic backed up or was the doctor backed up or what was happening? But efficiency starts from the time that a patient schedules an appointment with our practice. So having online pre-registration options or maybe even self-serve kiosks to help reduce the wait times at check-in. Having records that are, digital, maybe automated insurance verification to speed up administrative tasks for eligibility. And being able to have real-time communication between departments. Sometimes that's leveraging messaging systems, or, how do you utilize your overhead paging? Where are you spending your time in being able to communicate in an efficient way? And then also having standardized processes and protocols to help eliminate inefficiencies and also inconsistencies. When there aren't standardization in place, then people are free to figure out on their own, so to speak, what to do. And not everyone's going to follow that same process. It also improves the confidence on our team to have the tools they need to be successful. When people are confident, they move more efficiently and they're more productive when they know what is needed and expected of them. And think about as well today, what type of coverage do you have for your teams? Do you have roles that no one else can do because maybe only one person knows how to do it? What happens when that person gets backed up, or if they're out unexpectedly for 12 weeks? Patient care suffers. So poor patient flow can lead to physicians and staff becoming overburdened, maybe stress and fatigue. A well-organized flow distributes workload evenly. It improves the job satisfaction and the retention. And when patient flow is not actively improved upon, once areas are identified, we can be vulnerable to losing patients to competition. You think about competition and what the competition is these days. Even us as consumers, we're researching before we go somewhere. We're looking at online reviews. Maybe it's a restaurant, maybe it is a surgeon or a medical practice, but patients are educating themselves and they'll drive the distance for a better experience. They'll figure out a way to do an online service, even if it's not the best quality of care, but their perception is that they're receiving better care because it's efficient. So really thinking about how do we keep patients in our practice, and these efficiencies really, it can really impact whether or not patients choose to stay with us. You may be surprised to know that only 3 things happen naturally in an organization. Now, there's several things that can happen naturally, but the top 3 things that take 0 effort is friction, confusion, and underperformance. Think about the last time you had a great experience and you got the care you needed without unnecessary delays. It kind of leaves us feeling confident that we got the care that we received, right? Well, that's the power of optimizing patient flow.
So this is a series of webinars put on by iTech Training. We devote our work to helping administrators and helping to train and develop technicians, and looking at profitability, ways to increase profitability, revenue in your office. And Mandy Kanzler happens to be our expert on the team about this subject, which is why she's teaching this series. And she has worked wonders with some practices. So we just want to let you know that Mandy is someone who can help you if you have any of these needs. But hopefully we're also giving you information so that you can affect some changes yourself in your practice. Mandy?
Yes, thank you, Sharon. So as Sharon said, we do help assist with these services as well. And if you have questions, for those of you that just jumped into the meeting, feel free to utilize the chat, or at the end of the webinar, you'll see our email to where you could reach out as well. So you may be asking, all right, that's great. We've identified all of these inefficiencies. We see them in our practice, but how do we assess it? We know they're there. How do we assess it? Maybe we're not really sure where to start. Well, identifying inefficiencies in each department, and it's not just the clinic, all of these departments overlap, from the front office, surgery scheduling, optical, our billing department. So we want to observe and evaluate what the skills are to identify where are these inefficient workflows, or maybe it may be inefficient performance of a particular team member. And in those times, we consider, maybe training, gap training in an area, further development and education for whatever that specific role is or area that you notice the inefficiency. And standardized workflows, being sure that we have streamlined workflows that people are able to follow, evaluating what are our processes. And maybe you have multiple departments, not just departments, but locations. And it's hard when staff go from one location to another and things are being done so vastly different. And I commonly see this in practices. And that someone in this particular practice knows what to do at this location. But if they're moved to another location, it's so vastly different. They're like a fish out of water, and it's hard for them to be efficient and confident in what they're doing. And so being sure that we have standardized processes between our front office, our clinic, surgery scheduling, contact lens, optical. So maybe think about as well, how versatile are your team members? We talked about coverage a couple of slides ago. What does coverage look like in your clinic? But do you have, if it's in the clinic, do your techs have the foundational skills to be able to perform a long exam, a comprehensive exam, being able to have a standardized protocol that they could do a comprehensive exam in any doctor's clinic? Now, every doctor has their own pet peeves or nuances, if you will, that maybe they want the AR slip attached, the auto refraction attached to it, or they want the patient's purse put in the chair versus the floor, or they want to be notified of certain things. I'm not talking about all of those little things that we learn as we get more experience with physicians, but just the core basics of what those skills are. Do you have hybrid roles in your clinic? So, some departments are smaller than others by nature. The surgery scheduling department is typically a little smaller than the technician department. Maybe it's that you have a large front office, but then you have an eligibility team that's a small team. And so having hybrid roles to where you could cross-train team members that can work between two departments. I've had roles that work very well between the clinic and contact lens or the clinic and optical. So that if someone's out on vacation, they're on extended leave, maternity leave, happen to be out sick for a few days, that we're able to fill in and cross-train and utilize our people well. And it also gives them an opportunity to grow. When people grow, they stay engaged. They're committed to the greater purpose because they feel that they're bringing value to the practice. So don't be scared to think creatively about using hybrid roles to engage your people. And it's going to make them better rounded for your practice as well. Someone who understands optical and the front desk, or the front desk and surgery scheduling. So these are things that you could think of having someone that maybe works 2 days a week in one department, 3 days a week in the other department, but no less than 2 to 4 days a month to be able to keep their skills up so that they can, once again, remain efficient in both of their roles. Now, technology can be our best resource when we're assessing inefficiencies. Sometimes technology can be frustrating for us, but when it comes to having information and data, technology can be our best friend. So when we think about the front office processes, do you have online patient portals or platforms that automate what the pre-visit information is for the patient? For the patient to either fill out forms, maybe update their insurance, review medical history, and does it integrate well with the EHR that you have in place? Are patients able to confirm appointments via text or email? And it's helpful as well if you have a digital platform that can communicate with patients, then are you able to list into certain types of appointments when you're notifying the patient to come in for certain visits, maybe to bring a list of medications or specific documents. Maybe they're coming in for an H&P or for a consult. So being able to communicate with patients so that they're prepared as well to help them be a good historian and help us efficiently move through that visit. Are patients able to cancel online in your practice? If they're not able to cancel an appointment online, then they're calling in to have to physically speak with someone, figure out which phone prompt to hit to get to the right department, which prevents staff from being able to be utilized at a higher level to answer questions and schedule maybe complex types of visits or make that referral appointment for a patient. So really utilizing technology to speed up what some of these processes are. We spoke briefly earlier about maybe considering electronic check-in kiosk or even mobile apps. Sometimes these can reduce wait times for patient intake. Now, in terms of clinic software, imaging systems are something that can really slow us down in the clinic. Whether it be that you're viewing images through Access, or if it's Optos or Heidelberg, how are images viewed by the provider and the technicians that are having to navigate to find these images? Is it efficient? Are they able to do comparisons and overviews from previous scans or testing that have been done? And then, as well as not just the imaging systems, but in clinic software in your EHR, are there areas that things are being typed over and over and over? Maybe it's in the intake, maybe it's in the scribing part of the visit. But if there are areas, make your EHR work for you. Either create that into a pick list or create a phrase that you're not having to type the same redundant phrase for certain types of visits, so that you can function at a higher level, listening to the conversation, customizing what truly is going on outside of those basic things that you're always going to document. And productivity. Now, when we think of productivity, oftentimes staff think, oh, they're just looking to see how many patients am I working up. And while, yes, that is important, we want to be sure that our staff are functioning within the benchmarks for these templates to flow well. But where are these patients spending their time? Have we really adopted using the patient status within our EHR throughout our entire practice? Are patients waiting at the front to be checked in at the front desk? It's a way for us to measure where the bottlenecks are happening so that it's not a manual timeline process. Maybe you have cameras you can use to see the front desk. When are patients backed up out the front door? Is it first thing in the morning? Is it right after lunch? Is it the end of the morning? And then being able to see, okay, if it's between the patient being worked up and waiting for the physician, then the backup is waiting on the physician, or maybe it's diagnostic testing. So being able to use tracking within your system for productivity to see where are the patients truly waiting at the longest. Now, speaking to appointment templates, kind of the magic, the question that if anybody could solve it in ophthalmology, we would all be super excited. But it's really a combination of things in terms of having an appointment template that works. To have a timely template that works, you want to do a time flow analysis, which once again, you can use technology if you have EHR to look at some of these areas for bottlenecks. But some questions to ask is, when does the doctor start seeing patients? If the doctor arrives at 8 o'clock, are patients ready then? And if patients aren't ready at 8 o'clock, when do the patients need to be scheduled for our staff to arrive in the office so that patients can be ready? So then when the physician shows up, they're productively using all hours of their time. What type of clinic flow are we looking at? If there are backups or bottlenecks, if there's a delay in getting started in the morning or certain areas that are backing up, it's important to understand between retina, glaucoma, cornea, plastics, where is this backup at? Maybe all the post-ops are coming in at the same time and checking in at the front office during high patient volume times for maybe it's a retina injection clinic going on at the same time. So thinking about, it's one big puzzle. If patients are all checking in for retina injections or for one-day post-ops at the same time that we have a lot of patients checking out, then some things that you could consider is, if it's a quick visit to be scheduled, maybe it's a return post-op or just a return injection, would that be better served thinking of someone in the clinic that can make that appointment and let the patient bypass out the door? Now, these, of course, these are things for you to discuss within your practice, depending on where you collect money. But collecting money at the front of the exam, on the front end, front loading that instead of at the end, these can make some other things possible to kind of move things around. We always want the physician to be the limiting factor. So having enough resources in place that the physician is able to utilize their time well. And if patients are waiting, then they're waiting on the physician, not because we don't have all of the other pieces in place. Start small, see what works. When you're looking at reworking a template, Use the information you have from your analysis and start from there. If we make too many changes at one time, we're not going to know what worked versus what isn't working because there's so many things going on. So you maybe choose a day that makes sense to pilot the process. If you're working in a specific clinic, that think of increasing that volume, think creatively. So we want to start small when we're thinking about planning for a template. When you're going to do a template change, first of all, gather your data, what your analysis is of what are you trying to accomplish? Are we wanting to increase the volume for a physician? Is it that it's not flowing well in certain places? Whatever that is, but don't make too many changes at one time. Start with a day, a specific day or a specific clinic, and make changes and pilot that. I would pilot it for 3 or 4 weeks. Be sure that you have the technicians that you need to support the volume so that you're giving it a good opportunity for success. If it's a template that needs 3 workup techs and a scribe to happen, be sure you have 4 techs that are on the floor when you implement that template. And we always want to be sure that we're building that template to match the resources that we have. We can't work up, 50 patients in a half day with 2 workup techs. So being sure that depending on how heavy of a schedule is it, how many long exams, post-ops, short exams, so understanding that we have all of the resources that we need. And then once you've tried it, implement it, pilot it for 3 or 4 weeks before making master schedule changes. Celebrate with your team when things go well. Test it out. Test that flow on a small group and refine it. But if it doesn't go well with your team, be transparent as well. Be transparent when it doesn't work out and communicate that you'll keep working together until you get it right. Our team loves to be part of the process. So ask for input, ask for ideas. Our team sometimes can help us identify details much faster than we can on our own because they're in the trenches of the everyday challenges. And sometimes we can miss the minutia after being functioning, operationally a little further away from what those details are. So be sure and involve some people to be a part of that process so you have people to celebrate it with whenever it does go well. When we streamline processes, patients get timely care, which means better health outcomes and higher satisfaction. Sometimes it's not necessarily a better visual outcome, but to a patient, the perception of the outcome is the reality. So did they have an outcome that felt more frustrating than what it should have been simply because it was a poor experience and inefficient? Staff can work more effectively, avoiding burnout and frustration when things are moving efficiently. Resources, whether it be rooms, equipment, or personnel, when they're used wisely, it can lead to cost savings as well. Efficient workflows also ensures that patients are seen when they need to be. While a well-organized registration and checkout process can cut down on confusion and delays, we have to remember that the communication is so important. When everyone's on the same page, from the front office, the front tech desk, from the front office staff to the technicians, things can run much more smoothly. But ultimately, optimizing patient flow isn't just about efficiency. It's about creating a better experience for both patients and the physicians and your team members. When we standardize these as best practices, we ensure consistency and we also reduce errors. Think about the phrase you may have heard that time equals money. Well, why is that? Because time is valuable. The patient's time is valuable. They're spending time with us, and we have to spend that time well. So as we kind of move towards some of these conclusions and suggestions for the day, we've talked about, some optimizing workflows, effective methods of how do we enhance efficiencies while we're still maintaining quality or even improving the quality of care. Maybe you're an administrator that's listened to this webinar today and you've identified multiple areas that could be more efficient in your workflow of your practice. Sometimes our wheels get turning and we can get to feeling overwhelmed and we don't really know how to start. Maybe your administrator is trying to do it on your own and you don't have a lot of support around you, or maybe you're newer in the role. It's okay. Start somewhere. whether it be bottlenecks that are happening for, diagnostic testing or check in or check out, pick an area and break it down with data by doing some time studies. Put a plan together with a timeline of when you want that initiative completed and start working backwards. If you want results by the end of April, start now. It's hard to measure where you're going and to get there in time if you don't have your timeline set up. So put yourself a good deadline in place so that you can begin working backwards, that you're actively making improvements each week or putting some solutions in place. And if your resources are currently stretched, or maybe you're a new administrator that doesn't know where to start, that's okay. You can reach out to us here at iTech Training. We'd be honored to help provide solutions to empower you and your practice to grow in 2025. Sharon?
Yes, thanks, Mandy, for all that great information. I want to invite all of you to join us for March's webinar. And again, it'll be free. It'll be at 2 o'clock on Thursday, March 13th. And this is our third in our series of optimizing your practice. We're going to be talking about what top metrics you should be tracking in your practice. Thank you for joining us today and have a good rest of your afternoon.